Hello guys, welcome to my new live. So as I have explained already that this live is only for the preparation of which I am preparing for the NEET or upcoming AIPGT exam. So basically there are so many subjects as we all know, like Materia Medica. The important subject which I am going to speak about, like Materia Medica, Organon, then Materia Medica, Organon, Repertory, uh, medicine, anatomy, physiology, first year subject. Like the important subject is like Materia Medica, Organon, and repertory. That is fourth year subject. Other all subjects are included, but the weightage is given to the only fourth year subject, like main subject, which is mainly homeopathy is based on. So as I read already yesterday, from 2 days I was reading the same book, uh, which is Materia Medica. So I was kind of little bit bored. So I started reading the repertory. In that repertory, yesterday I read few uh, rubrics, like meaning of rubrics. So I was going through with the rubrics. Those who are uh, trying to crack, those who are trying to study, those who are trying to give exam in the 2026, which is going to held in I think June, July. So they can read with me, and if you have any doubt, you can ask also. So we will start. Important pathological journals in BBCR. So atrophy and emaciation, sensation and complaints in general, chlorosis, sensation and complaint in general, constitution, sensation and complaints in general, consumption, sensation and complaints in general, conversion and spasm, sensation and complaints in general, all are psychosis, sensation and complaints in general, syphilis, sensation and complaints in general. Some important rubric in BBCR: alcoholism and intoxication, which is in mind, awkwardness mind, guilt sense of mind, hydrophobia mind, hypochondriasis mind, hysteria mind, sensation of complaints, uh, confused mind, confusion sensorium, muscle do not respond to will mind, phlegmatic mind, unconscious shy aversions to society mind, and phlegmatic mind, so, society aggravation, aggravation and amelioration, yielding disposition mind, faintness, sensorium, sensation and complaints. Then faintness is in sensorium, sensation and complaint. Hydrocephalus head, hydrocephalus head and internal head, in head it is mentioned in the internal. Parotid gland, which is mentioned in the ear and face, that is obviously. Sinuses, nose, sneezing, coryza. Zygoma, face. Glands, salivary, mouth. Stomatitis, mouth. Vulva, mouth, palate. Diphtheria, throat. Globus hystericus, throat. Aversions and desire, appetite. Hiccup, eructation and hiccups. Cough ends in eructation, eructation, aggravation. Acidity, stomach, heartburn, eructation, pancreas, diaphragm. Spleen, gallbladder, hypochondrias. Spleen, gallbladder, hypochondrias. Ascites, abdomen, hernia, inguinal and pubic region. Hydrocele, genitalia, scrotum. Hydrocele, genitalia and scrotum. Pregnancy complaints during genitalia, female organ. Pregnancy aggravation and amelioration. Pregnancy aggravation and amelioration. Prostatic fluid loss of stool during sexual impulse. Prostatic fluid loss of stool during sexual impulse. Kine stroke respiration, that is mentioned in the respiration. Croup, larynx and trachea. Asthma, miliary, spasm of larynx and trachea. Bronchitis, chest. Tuberculosis, pulmonary, chest. Angina pectoris, heart and region of. Goiter, heart and region of. Air aversions to open, sensation and complaints. Anemia, fever, circulation. Anemia, fever and circulation. Okay. Asphyxia, sensation and complaints. Anxious feeling, internal anxiety, sensation and complaints. Anxiety in limbs, anxious feeling, sensation and complaints. Asleep, sensation in limbs, sensation and complaints. Atrophy of different parts, sensation and complaints. Carried, wants to be, mind aggravation and amelioration. Carried, wants to be, mind aggravation and amelioration. Constitution, sensation and complaints. Symptoms of joints, sensation and complaints. Hemophilia, sensation and complaints. So I was reading the clairvoyance, the power to perceive matter beyond the range of the ordinary perceptions. Contentions, quarrelsome, irascibility, cross reference. Dictatorial, dogmatic, domineering, similar rubric. Disgust, irksome, ennui, similar rubric. Eccentricity, changeable behavior. थोड़ा ऊपर लग रहा है, 1 second, sorry to disturb, sorry. I think now it's fine. extravagance, great desire to spend money which may be unaffordable, frivolous, silly, gaiety, cheerful, vivacious, cross reference, groaning, moaning, cross reference, grumbling, complaining, hatred, malicious, misanthropy, resentment, revengeful, vindictive, imp- imperious, always force their views on others, haughty, cross reference, impertinence, impertinence, insolent, rudeness, similar rubric, impertinence, insolent, rudeness, similar rubric, impetuous, do things abruptly in an impulsive manner without any thought of consequences, hurry, do things in a haste without excitement, impatient, restless, similar rubric, impatious and impatient. Okay, jesting, disposition to jokes even in serious conditions, jesting, disposition to jokes even in serious condition, fast, facetious, witting, similar rubric, lively, mirth, hilarity, cross reference, mania potu, delirium in alcohol withdrawal syndrome, middlesome, interfere in others' business, morose, sullen, similar rubric, occupational unrelation, excitement, entertainment, similar rubric, pertinacity, persist or holding firmly even if others disagree, a petulant, peevish without reason, irritability, cross reference, phlegmatic, indifference marked by slowness, indifference, cross reference, positiveness, obstinate, pride, haughty, mortification, cross reference, prophesying, foretelling future events, for foretelling future reference. Okay, reapproaches, scold severely, reapproach, scold severely, resolute, determination to face circumstances against all odds, courageous, cross reference, reverence, fear mingled with profound respect, veneration, extreme respect, similar rubric, sobbing, weeping with audible, yeah, this is important rubric, sobbing, 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 weeping with audible breathing, sighing, weeping with audible long breath. Okay, sobbing, weeping with audible breathing, weeping with audible long breath, weeping, grief, express grief or anguish by tears, cross reference, solemn, serious, cross reference, somnambulism, an action performed while sleep, not able to recall later. Okay, somnambulism, vacillation, inability to decide anything, fluctuate in opinion, mood, whimsical, cross reference, vivacious, happy and cheerful, full of life. Rubric hunting from Kent Repertory. Okay, artificial behavior designed to impress others, mind affection, a person desired to possess something which belonged to others, mind covetous, an extreme sense of self importance or boastfulness, mind egotism. Okay, a state of emotion so intense that one is carried beyond thought and self control, mind ecstasy, agonizing physical or mental pain, mind anguish. Okay, agonizing physical or mental pain, mind anguish. Kent repertory is important, so that I am reading all the things about Kent, BBCR, and one more repertory is there, BTPB. So, arousal of public interest in cause or controversial matter, mind agitation, anger when thinking of complaints, mind anger thinking ailments. Okay, avoid sight of people, mind company avoid sight, aversions to certain people, mind aversion. Okay. कोटेशन एक बार पढ़ लेता हूँ. Group is more important than a single symptom, no matter how much peculiar it is. Boenninghausen. Group is more important than a single symptoms, no matter how much peculiar it is. Boenninghausen. One single symptom may it be ever so complete and plainly pronounced, cannot represent all the signs of disease which are externally perceptible, nor can it be enabled to guess the rest. Boenninghausen. The isolated study of drugs in homeopathic Materia Medica is a meaningless exercise. It has to be studied in relation to areas of similarity and dissimilarity. J.H. Allen. Characteristics particular, however, particular is not a guide to the remedy, are at least three characteristics must be present for a rational prescription. C. GuernseY. Without case record, you are at the sea without a compass or radar. J.T. Kent. Without a case record, you are at sea without a compass or radar. True, some men do some good work without the repertory, but they also do poor work more than they would do it with it. J.T. Kent. Our materia medica is so circumbrant, sorry, cumbersome. Our materia medica is so cumbersome without a repertory that the best prescriber must meet this only indifferent result. J.T. Kent. Every attempt to convert either the materia medica or repertory into language or traditional medicine must result in total failure. J.T. Kent. A strong general will overrule many member of particulars. J.T. Kent. A mechanical use of repertory never leads to artistic prescribing nor it remarkable result. J.T. Kent. A physician must read over and over the rubrics in a repertory in order to learn what is it, what is in it, and how symptoms are expressed. J.T. Kent. Get the strong, strange, peculiar symptoms and then see that to it that there are no generals in the case that oppose or contradict. J.T. Kent repertory is essential to and essentially an index. C.M. Boger. Every repertory is useful. Unfortunately, not one is complete. C.M. Boger. Every repertory is useful. Unfortunately, not one is complete. The mental concomitant are the immense value in physical ailments and vice versa. Broadman. A tool is as good as the workman who handle it. A bad workman naturally blames his tool when things start going wrong. M.L. Dhavle. Concomitant symptoms are based. So the comparison of rubrics in Kent, BTPB and BBCR. Hydrophobia in Kent, mind; in BTPB, sensation and complaints, water, dread of; BBCR, mind, hydrophobia; sensation and complaints, hydrophobia. Hysteria, mind in Kent, mind, hysteria; sensation and complaints, hysteria; mind, hysteria; sensation and complaint, hysteria and hypochondriasis. Ailments from joy, mind, joy; ailment from aggravation, excitement, joy; mind, gaiety, joyfulness; effects of jealousy, mind, jealousy, uh, like first Kent, BTPB, then BBCR. Jealousy, mind, jealousy; aggravation, excitement, jealousy; mind, jealousy; sensation and complaint, jealousy. Delirium tremens, mind, mania, potu; intellect, delirium; mind, delirium tremens. Illusion of touch, in generalities, touch, illusion of; sensation and complaints, illusion of. Okay. Aversion to touch, mind, touch, aversion to; sensation, complaint, touch, aversion to; mind, touched, aversion to being. Delirium, mind, delirium; intellect, delirium; mind, delirium. Okay. Delirium in everywhere it is mentioned in the mind, even in Kent. No. In BTPB it is mentioned in the intellect. In Kent it is mentioned in the mind. Delirium in Kent it is mentioned in the mind. In BTPB it is mentioned in the intellect, and in BBC it is mentioned in the mind. Vertigo, yeah, this is also mentioned in the intellect. Vertigo in Kent it is mentioned in the vertigo chapter. In BTPB it is mentioned in the intellect and BBCR vertigo. Falling of hair from beard. Face, falling of whiskers; face, falling of whiskers; skin, hair falling from beard. It is mentioned in the, see, in BTPB it is mentioned in the skin. This is very important. Falling of hair from beard. Face, falling of whiskers; in BTPB, skin, hair falling from beard; head, external hair falling out from beard in BBCR. Okay. Then photophobia. In Kent it is mentioned in the eye, photophobia. In BTPB it is mentioned in the vision, photophobia. Okay. In BBCR both in eye and vision, but more medicine in vision. Okay. Photomania. Eye photomania. Eye photomania. In Kent it is mentioned in the eye, photomania. In BTPB it is mentioned in the vision, photomania. Both in eye and vision. Short sight, vision myopia. In Kent direct rubric it is mentioned in the vision myopia. Visions in BTPB, vision short sighted. In BBCR, vision myopia. Okay. Epistasis, nose epistasis sorry, nose epistasis in Kent, nose epistasis; nose bleed, nose bleeding. Okay. Illusion of smell, nose odor; smell illusion of, nose smell illusion of. Okay. Circumscribed redness of cheek; circumscribed redness of cheeks; face discoloration, red circumscribed. Okay. Face circumscribed redness of cheeks; face red circumscribed on cheeks. Okay. Face everywhere circumscribed redness of the cheeks, everywhere it is mentioned in the face. Okay. Comedians, blackheads; face eruptions, comedion; face acne, comedions. Okay. Comedions, face eruptions, comedion; face comedion; face acne, comedions. Rhesus sardonicus, rhesus sardonicus; face rhesus sardonicus; face drawn, face rhesus sardonicus; face drawn, face rhesus sardonicus. RISUS sardonicus, 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 face, everywhere it is mentioned the face. Exophthalmos, it is mentioned, actually it is related to the eyes. Eye protrusion, exophthalmos, face, eye protruding. In Kent it is mentioned in the eyes protrusion, exophthalmos, but in the BTPB, face, eyes protruding, oily face, face greasy, face oily, face glistening, greasy. Yeah, now it is fine. So fine. Open mouth, mouth open, in BTPB, face open mouth, in BBCR, mouth open. Toothache, teeth pain, toothache, teeth pain simple. Hot breath, respiration hot breath, mouth breathe hot, respiration hot breath. In BTPB only it is mentioned somewhere here and there, so that we have to check properly. In toothache, like toothache, it is mentioned in Kent, it is mentioned in the teeth pain toothache. In BTPB it is mentioned in the teeth toothache. Then BBCR teeth pain simple. Hot, like hot breathe, respiration hot breathe, in again it is mentioned in the mouth breathe hot, then BBCR respiration hot breathe. BBCR and Kent somewhere it is okay, but BTPB, like it is very small book, so they have mentioned here and there. Cold breathe, mouth cold, mouth breathe cold, respiration cold breathe. See, hot breathe in Kent it is mentioned in the respiration hot breathe. Then cold breath in Kent it is mentioned in the mouth cold. Okay, it is very confusing. Tonsillitis, throat inflammation tonsil, throat tonsil plus sensation and complaints gland tonsil. It is mentioned in the BTPB. Mouth, throat and gullet inflammation tonsils. Burn taste, taste impyreumatic. Wow, taste impyreumatic. In Kent, it is mentioned in the taste im, impyreumatic. Taste burnt, in BTPB. Taste burnt, taste impyreumatic. Okay. Loss of taste, mouth taste wanting. In Kent, it is mentioned in the loss of taste, mouth taste wanting, taste lost, taste lost. Okay. Heartburn, stomach heartburn, it is mentioned in the stomach heartburn. Eructation in the BTPB, it is mentioned in the eructation heartburn. Water brush and heartburn. Okay. Hiccup, stomach hiccup, eructation hiccup, and PVO hiccup. Water brush, stomach eructation water brush, eructation water brush. Heartburn and water brush, water collects in mouth, water brush. Hematemesis, stomach vomiting food. Hematemesis, stomach vomiting food. Nausea and vomiting bloody. Wait. Hematemesis, one second, let me take a book so that I can write something. Sorry. Yeah. No, this one is someone else. I don't have book now. Sorry. Burnt taste, it is taste burnt, etc. Okay. Hematemesis. So whatever I write, that will be kept in my mind. Hematemesis, stomach vomiting. Blood. Okay. Hematemesis is mentioned in the stomach, vomiting, blood. In BTPB, nausea and vomiting bloody. Nausea and vomiting blood. Hernia. In Kent, it is mentioned in the abdominal hernia. Internal abdomen hernia. Inguinal and pubic region hernia. BBCR. Incarceration of flatus. Incarceration of flatus. It is mentioned in the Kent abdomen. Flatus obstructed. Okay. In Kent, it is mentioned the flatus obstructed. Flatulence, it is BTPB. Flatulence, incarceration of flatus. Incarceration of flatus. Flatulence, flatus incarcerated. Diarrhea. Diarrhea, it is mentioned in the Kent rectum. Diarrhea. In Kent it is mentioned in the rectum diarrhea. In BTPB it is mentioned in stool diarrhea, and BBCR again it is mentioned the stool diarrhea. Hello, hello, the just shine. Hello, diarrhea. Hi, hello, hello. Worms, WRMS, worms. It will be mentioned in the rectum in Kent. Okay. In BTPB it is mentioned in the stool, worms, and again it is mentioned in the stool, worms in BBCR. Okay. Hemorrhoids. Hemorrhoid again in Kent it will be mentioned in the rectum. Rectum. Hemorrhoids again it will be mentioned in the rectum. Hemorrhoids. Stool again in BTPB, stool, hemorrhoids, and in BBCR anus and rectum hemorrhoids. Okay. Diabetes mellitus. Diabetes mellitus is, it will be mentioned in the urine. In Kent it is mentioned in the urine sugar. Urine sugar. In Kent it is mentioned urine glycosuria. Glycosuria. Urine glycosuria. Diabetes mellitus, urine glycosuria. Urine saccharin. SACCHARIN is saccharin. Okay. Urine sugar, urine glycosuria, urine saccharin. Okay. Nocturnal enuresis. Nocturnal enuresis. It is mentioned in the bladder, urination involuntary night in bed. Okay. In Kent, bladder, urination involuntary night in bed. Nocturnal enuresis, bladder urination involuntary sorry, bladder urination involuntary night in bed. Micturition involuntary at night. In BBCR, urine micturition involuntary in bed. Okay. Then nocturnal analysis done. Labor like pain. LABOUR, labor like pain. In Kent it is mentioned in this uh, gen, general female. General it is female. Pain, labor like pain. Pain, labor like. Then labor like pain. Sensation and complaint like labor like pain. Okay. It is mentioned in the sensation and complaint. Labor like pain. Hello everyone. Hello, 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 hello. Genitalia. Female. organs, female organs, labor like pain. Hi SK Elver. Hello. Impotency. Impotency, general male erection wanting impotency. Sexual organ impotency. In BTPB, sexual organ impotency. Sexual organ impotency in BTPB. Then in BBCR, sexual impulse impotency and weakened power. So impotency, it is mentioned in the Kent, it is mentioned in the general male erection wanting impotency. In BTPB it is mentioned the sexual organ impotency. In BBCR it is mentioned the sexual impulse impotency and weakened power. Abortion. Abortion, general female abortion in BTPB. It is very important in BTPB. BTPB always BTPB. See, abortion, it is mentioned in the menstruation abortion. Nobody will think like it is it will be mentioned in the abortion. Menstruation abortion. Genitalia female organ abortion in BBCR. Delayed first menses in girls. Genitalia female menses. Menstruation, delayed first menses in girls. Menstruation, tardy at puberty. Okay. Wow. Oh, sorry. Acrid leukorrhea. In Kent, generality female leukorrhea, leukorrhea acrid. BTPB, menstruation, leukorrhea acrid. Salty expectoration. Expectoration, taste salty. Salty expectoration, expectoration. Expectoration, taste salty. Cough, taste of expectoration salty. Okay, let's see again. Here it is mentioned in the cough, salty expectoration. In Kent, expectoration, taste salty. Cough, taste of expectoration salty. Cough, expectoration, taste of salty. Okay. In Kent it is mentioned the expectoration, taste salty. BTPB and BBCR both places it is mentioned the cough. Hoarseness of voice, larynx and trachea, hoarseness of voice. Okay, hoarseness of voice, larynx and trachea, voice hoarseness. Air passage in BTPB it is mentioned the air passage, voice hoarseness. Okay, voice and speech, hoarse. Okay, in hoarseness of voice in larynx and trachea, voice hoarseness in Kent. In BTPB, air passage, voice hoarseness. Voice and speech in BBCR, voice and speech, hoarse. Okay, goiter. Let's see goiter. GOITER, goiter, external neck, I think it is here, external throat goiter in Kent. External throat and neck, thyroid gland sensation and complaints, gland swelling, neck and external gland. Okay, that is easy. Palpitation, chest palpitation, fever and circulation. Wow, see, palpitation, it is mentioned in Kent, chest palpitation, that is easy. In BTPB also chest palpitation, but in BBCR it is mentioned in fever and circulation, chest fever and circulation, it is mentioned the under palpitation. Okay, important, palpitation. Eruption in axilla. Eruption in axilla, chest eruption, axilla. Okay. Eruption in axilla, chest, eruption, axilla. Upper extremities, axilla plus sensation and complaints. Upper extremities, axilla, sensation, complaint, skin eruption. Chest, axial eruption. Diaphragm, diaphragm. DIAPHRAGM, diaphragm. It is mentioned the chest diaphragm not as separate rubric but as sub location under some rubrics. Okay. Abdomen diaphragm. In BTPB, abdomen diaphragm, abdomen. In the Kent, it is mentioned the chest. Hypochondrium diaphragm. Okay. Desire for open air, generalities, air open, desire for. Sensation, complaint in general, air open, desire for. Desire for open air. Generalities, open air. Okay, Kent. Generalities, open air. Okay. Sensation and complaint in BTPB. Sensation, complaints, open air, air open, desire for. Sensation and complaint in general, open air, desire for. Okay. Desire for open air. Apoplexy. Generalities, apoplexy. Sensation and complaint, apoplexy. Sensation and complaint, apoplexy. Tendency to take cold. Generalities, cold tendency to take. Awkwardness. Awkwardness. Extremities, awkwardness. Okay. Extremities, awkwardness. Extremities, awkwardness. It is very important rubric. It can come to the Viva or anything exam also. Awkwardness, it is mentioned in the extremities awkwardness in the Kent. In BTPB, sensation and complaint, generalities, clumsiness. Mind, in the BBCR it is mentioned in the mind, awkwardness. Wow. Conversion without consciousness. Conversion without consciousness. Generalities, convulsions, consciousness without. Sensation complaints, convulsions without consciousness. Sensation complaint, epilepsy, consciousness without. Jaundice, skin discoloration, yellow jaundice. Jaundice, skin discoloration, yellow jaundice. Okay, jaundice, skin yellow, skin color yellow. Okay, inclination to lie down. In generalities, lie down, inclination to. Generality in BTPB, sensation complaints, lie down, inclinations to. Sensation complaint, lie down. Malaise, generalities, lassitude, sensation complaint, malaise, sensation complaints, fatigue, malaise, fatigue. Okay. Diagonal affections like upper right and lower left, etc. Generalities, side, sensation complaints, side crosswise, sensation complaints, uh, direction diagonal. Okay. Sprain, generalities, lifting, sensation and complaints, sprain, aggravation and amelioration in general, lifting and sprain, that is important. As I can see, it is sprain, generalities, lifting in Kent. In BTPB, sensation complaints, sprain. In BBCRs, aggravation and amelioration in general, lifting and overlifting. Okay. So I think I read almost 60 rubrics. So the important which one I found it is very strange or very difficult. It is delirium, vertigo. Yeah, delirium. In Kent it is mentioned mind delirium. In BTPP it is mentioned in the intellect delirium and mind delirium BBCR. Okay. Vertigo it is mentioned in the Kent vertigo, intellect vertigo and vertigo. That is important, which have to remember. Then exophthalmos, eye protrusion, exophthalmos it is mentioned in the Kent. Face, eye protruding it is mentioned in the BTPB, and okay, this is also okay. Then abortion, abortion it is in general female abortion. In Kent it is mentioned the general it is female abortion. In BTPB it is mentioned the menstruation abortion. This is very important. Then again awkwardness, this is very important. I think in BBCR only it is mentioned the sensation mind, otherwise everywhere it is mentioned the like in Kent it is mentioned the extremities, awkwardness, and BTPB sensation, complaint in general, clumsiness. This is very important. Namaste. Arun Kumar. Okay. सर पढ़ा नहीं रहे, पढ़ भी रहे हैं. Still many more are there, like 109, 50, 60 I read, 50 more I have to read, 60, 40 around. I have little bit neck pain, because of that I'm little bit hot patient generalities, heat sensation of sensation and complaint in BTPB, sensation and complaint, warm feeling, sensation and complaint, warm sense of. Caries of bones, caries of bone generalities, caries bones, skin and complaints, bone caries, skin and complaints, bone caries. Bloody sweat, bloody sweat, bloody sweat, perspiration, perspiration, sweat, indicant, skin and sensation complaint, skin, blood, sweating plus fever, sweaty, bloody, sweat, bloody, okay, fever, sweat, bloody, okay, fever, sweat, bloody. Scones, CORNS, cons, it is extremities cons. In Kent it is mentioned the extremities con, sensation and complaint, skin cons, BBCR, sensation and complaint, skin cons, scabies, skin eruptions, scabies, scabies, skin eruptions, scabies, sensation complaints, skin itch, scabies, sensation complaints, skin itch, scabies, okay. Ingrowing nails, ingrowing nails, ingrowing nails, ingrowing nails, extremities, ingrowing, extremities, ingrowing, skin, nails, growing inward, skin, nails, ingrowing. Bed sore, skin sore becomes bed sores, bed sore, skin sore becomes skin sore becomes skin soreness, excoriation, chafing. Ringworm, skin eruption, herpetic sarcinate, skin eruption, herpetic sarcinate, skin tetter, ringworm, skin tetter, ringworm. Somnambulism, mind somnambulism, sleep somnambulism, mind somnambulism. Walking somnambulism, somnambulism, it is mentioned in the mind in Kent, BBCR in mind, and in BTPB it is mentioned in the sleep. Okay. Pulse imperceptible, generalities pulse imperceptible, fever and circulation, pulse imperceptible. And one more thing I mentioned here is the palpitation, chest palpitation, fever and circulation, palpitation, okay. Varicose vein. Generality is varicose. Okay. I was thinking like varicose vein will be mentioned in the extremities, but in Kent it is mentioned in the generalities. Varicose vein. In Kent it is mentioned in the generalities. Obviously in BTPB it is mentioned in the no, circulation blood vessel varicose. Okay, circulation blood vessel varicose, and varicose vein in BBCR it is mentioned fever, circulation blood vessel varicose, VARICOSE, varicose. Okay. Sweat staining yellow. This is very, I think, sweat staining yellow. Sweat staining yellow. Perspiration staining yellow. It is mentioned in the perspiration staining yellow. Perspiration staining yellow. Fever, sweat staining yellow. Fever, sweat yellow staining. Okay. Fever, sweat yellow staining. Burns. Perspiration staining yellow. Fever, sweat stain yellow. Fever, sweat staining yellow. Burns. It is mentioned the generalities in Kent. Generalities. Burns. Generalities burn. In aggravation it is mentioned the burns. Skin burns. B. Aggravation, amelioration burns. Okay. At 10 o'clock I will take a break little bit, then I will read Materia Medica. That too, I'll read Materia Medica from the Boric especially I will read from the Boric book. Boric book I have to read Materia Medica around from 10 I'll start and I'll read till 11 o'clock. 10 से स्टार्ट करके 11 बजे तक मटेरिया मेडिका पढ़ना है. और मटेरिया मेडिका में बहुत सारे ड्रग्स हैं जो एक्चुअली मैं पढ़ना चाहता हूँ. मटेरिया मेडिका एंड एलन कीनोट और फाटक तीनों बुक से, बट एक ही साथ तीनों बुक से पढ़ना आई थिंक इट विल बी डिफ़िकल्ट, बट आई विल ट्राई. आई हैव ऑल थ्री बुक्स नाउ ओनली. आई विल स्टार्ट. और लेट्स टेक अ ब्रेक फॉर 5 मिनट्स. और आपको कुछ अगर पूछना है तो आप पूछ सकते हैं, आप बता सकते हैं कि अगर आप भी प्रिपेयर कर रहे हैं AIPGT के लिए या फिर आप एग्ज़ाम के लिए प्रिपेयर कर रहे हैं, आप फर्स्ट ईयर, सेकेंड ईयर, थर्ड ईयर BHMS स्टूडेंट या फोर्थ ईयर BHMS स्टूडेंट हैं, कोई भी डाउट है आपको तो आप पूछ सकते हैं. जैसा कि मैं पास आउट हूँ 2024 में, मेरा इंटर्नशिप कंप्लीट हो गया है, और लेकिन मैं ट्राई कर रहा हूँ PG करने के लिए. सो फॉर दैट आई एम स्टडिंग. आई होप जून जुलाई में एग्ज़ाम जो भी है उसमें क्रैक कर जाऊँ और एक अच्छा सा गवर्नमेंट कॉलेज मिल जाए. होपिंग फॉर द गुड. बाकी तो देखते हैं. ओके. सो आप लोग को कोई इंक्वायरी है आप पूछ सकते हैं रिगार्डिंग एनीथिंग, रिगार्डिंग BHMS, regarding exam, regarding anything. If you have a query you can ask to me. तब तक मैं बुक ले लेता हूँ, अपना तीनों बुक में ले लेता हूँ, जैसा कि बोरिक और एलेंस की नोट, देन फाटक. तो गाइस सेकंड, हाँ, तो जैसा कि मैंने बोला कि ब्रेक के बाद मैं मैटेरिया मेडिका पढ़ूँगा, वो भी बोरिक से. तो आप देख सकते हो, होम्योपैथिक मैटेरिया मेडिका एंड रेपर्टरी बाय विलियम बोरिक, दिस बुक. देन कीनोट HCLN, देन फाटक SR फाटक. तो देखते हैं. अब 45 minutes I will study the Materia Medica. Okay. Oh, पहले मैं कीनोट ही पढ़ूँगा, फिर बोरिक देखते हैं. First I will read in from the keynote, then borik, both at the same time. So Abrotanum, southern wood, compositae family, marasmus of the children with marked emaciation, especially of leg, iodum, sanicula and tuberculinum. The skin is flabby and hands loose in folds. Uh, loose in folds. In marasmus, I am reading the Abrotanum. In marasmus, head weak, cannot hold it up. Athusa. Okay, great weakness and prostration and a kind of hectic fever with the children unable to stand. Great weakness and prostration and a kind of hectic fever with children unable to stand. Child is ill-natured, irritable, cross and despondent, violent, inhuman, would like to do something cruel. Okay, cruel in Abrotan. Okay, generalities: ravenous hunger, losing flesh while eating well. Many drugs are there: iodum, natrum, saniculum, tuboinum, tuboinum. Okay, uh, face, face old, pale, wrinkled, opium. Then stomach and abdomen, alternate constipation and diarrhea, lenteria. Musculoskeletal system, painful contraction of the limbs from cramps or following colic. Okay, painful contraction of the limbs from cramps or following colic. Rheumatism for the excessive pain before the swelling commences from suddenly checked diarrhea or other secretions, alternates with hemorrhoids with dysentery. Okay, gout, joints stiff, swollen with pricking sensation, wrist and ankles, joints painful and inflamed, very lame and sore all over, marasmus of lower extremities only. Okay. Skin itching, chilblains, agaricus. Skin itching, chilblains, agaricus. Relationship: after hepar in furuncle, after aconite and brownian in pleurisy. Abrotanum, right? Okay. When a pressing sensation remains in affected site, impending respiration. Now I am going to read the same Abrotanum drug in the William Boric. So William Borick, what he says, abrotanum. Here abyss से start है, abyss canadensis and abyss nigra. Direct in the SCLN it is mentioned from the uh, abrotanum. So okay, a very useful remedy in marasmus, especially of lower extremities only. Yet with good appetite. Metastasis, rheumatism, following checked diarrhea, ill effect of suppressed conditions, especially in gouty subject. Tuberculosis, peritonitis, exudative pleurisy, and other exudative processes. After operation upon the chest for hydrothorax or empyema, after uh, after operation upon the chest for hydrothorax or empyema, a pressing sensation remains. Okay. Aggravation of hemorrhoids when rheumatism improves. Nosebleed and hydrocele in boys. Nosebleed and hydrocele in boys. Great weakness after influenza. Caliphos. Okay. Mind cross irritable, anxious, depressed. Face wrinkled, cold, dry, pale, blue rings around dull looking eyes, comedons with emaciation. Nosebleed, angioma of the face. Okay. Stomach slimy taste, appetite good, but emaciation progresses. Food passes undigested, pain in stomach, worse in night, cutting, gnawing pain. Stomach feels as if swimming in water. That is mentioned in the stomach feel as if swimming in water, abrotanum. Feels cold, gnawing hunger and waning, indigestion with vomiting of large quantities of offensive fluid. Abdomen, hard lumps in abdomen, distended abdomen, hard lumps in abdomen, distended, alternate diarrhea and constipation. Hemorrhoids, frequent urging bloody stools. Hemorrhoids, frequent urging bloody stools, worse as rheumatic pain abate. Ascarides, oozing up from umbilicus, sensation as if bowels were sinking down. Okay, sensation as if bowels were sinking down. The most important symptom in the abrotanum is extremities. The pain in shoulder, arms, wrist, and ankles, pricking, any coldness in fingers and feet. Uh, Legs greatly emaciated, joints stiff and lame, painful contraction of the limbs, eruptions. Eruption come out on face, are suppressed, and the skin becomes purplish. Purplish. Skin flabby and loose, furuncles falling out of hair, itching, chilblains. Okay, this is happened. This I read from the Boric. Now, the next remedy is absinthinum. Central nervous system convulsions are preceded by trembling, makes grimace, bites tongue, foams. Minor epilepsy were minor epilepsy where consciousness is not entirely lost. Minor epilepsy where consciousness is not entirely lost. Tremor of tongue, of heart, tremor of heart felt towards the back. Heart thumps can be heard in the back. Vertigo with tendency to fall backward. Spasmodic facial twitching, that is it is mentioned in the absinthium. Aceticum, aceticum acidum, acetic acid, that is same, glacial acetic acid, adapted to pale lean person with lax flabby muscles, face pale waxy. Okay, generalities: hemorrhage from every mucous outlet, hemorrhage from every mucous outlet, nose, throat, lung, stomach, bowels, uterus. Metrorrhagia, variceous traumatic epistaxis, marasmus and other wasting diseases of children. Abrotanum marasmus and other wasting disease of children. Abrotanum iodum saniculum tubovinum. Okay. Great prostration after injuries, sulfuric acid after surgical shock, after anesthetics. Oh, great prostration after injuries, after surgical shocks, after anesthetics. Okay, that is mentioned in the acetic acid. Thirst, intense burning, insatiable even for large quantities in dropsy, diabetes, chronic diarrhea, but no thirst in the fever. This is very important symptom. Thirst, intense burning, insatiable. Insatiable means after drinking a lot of water, not satisfied. The feeling of satisfaction is not there. That is insatiable. Even for large quantities in dropsy, diabetes, chronic diarrhea, but no thirst in the fever. That is mentioned in the acetic acid. Cannot sleep lying on the back, sleeps better on back hours, sensation of sinking in abdomen causing dyspnea, rest better lying in on belly. Okay. Respiratory system, true group, hissing respiration, cough with the inhalation, spongia. Last stages. Inhalation of vapor of cedar vinegars has been successfully used in croup and malignant diphtheria. Vinegar has been successfully used in the croup and malignant diphtheria. Okay. Stomach and abdomen, sore belching and vomiting of pregnancy, burning water brush and profuse salivation day and night. Lack salivations. Okay. Diarrhea, copious, exhausting, great thirst, in dropsy, typhus, phthisis with great night sweat. Fever, hectic fever, skin dry and hot, red spot on red left cheek, and drenching night sweat. This is very important symptom in the acetic acid. Wait, let me write once, otherwise I will forget this. In acetic acid, it is mentioned like hectic fever, skin dry, skin dry, and hot red spot on left cheek, left red spot on left cheek, and drenching night sweat. Hectic fever, skin dry, hot red part on the left, red spot on the left cheek, drenching night sweat. Okay, no thirst in fever. This is also important. No thirst in fever. Okay, no thirst in fever. Relationship, cedar vinegar antidotes carbolic acid. Okay, that is important. That is okay. Now I will read from the same thing from boric. So let me see in boric acetic acid what absentheism. Okay, that is not important. Acetic acid relations. This drug produces a condition of profound anemia. Anemia. This is a profound with the same dropsical symptoms: great debility, frequent fainting, dyspnea, weak heart, weak heart, vomiting, profuse urination and sweat, hemorrhage from any part, especially indicated in pale, lean person with lax, flabby muscles, wasting and debility. Acetic acid has the power to liquefy albuminous and fibrinous deposit. Acetic has acid has the has a power to liquefy albuminous and fibrinous deposit. Epithelial cancer internally and locally. Epithelial cancer internally and locally. Psychosis with nodules and formations in the joints. Heart cancer. Irritable, worried about business affair. Head. Nervous headache from abuse of narcotics. Blood rushes to head. Blood rushes to head with delirium. Temporal vessel distended. Temporal vessel distended. Pain across root of tongue. Face pale, waxen, emaciated. Eyes sunken, surrounded by dark rings, bright red, sweaty, epithelioma of the lips, cheeks hot and flushed, aching in the left jaw point. Stomach, salivation, fermentation in stomach, intense burning thirst, cool drinks distress, vomits after every kind of food, epigastric tenderness, burning pain as of an ulcer, cancer of stomach, sore belching and vomiting, burning water brush and profuse salivation, hyperchlorhydria and gastralgia, violent burning pain in stomach and chest, violent burning pain in stomach and chest, followed by coldness of skin and cold sweat on forehead, violent burning pain in the stomach and chest, followed by coldness of skin and cold sweat on forehead. Stomach feels as if she had taken a lot of vinegar. Stomach feels as if she had taken a lot of vinegar. Abdomen. Feel as if abdomen was sinking in. Frequent watery stool worse in morning. Tympanitis. Ascites. Hemorrhages from bowel. Urine. Large quantities of pale urine. Diabetes with great thirst and debility. Phosphoric acid. Okay. Female. Excessive catamania. Hemorrhages after labor. Nausea of pregnancy. Breast painfully enlarged. Distended with milk. Milk improvised, bluish transparent, sore anemia of nursing mother, respiratory, hoarse, hissing respiration, difficult breathing, inhaling, cough when inhaling, membranous croup, irritation of trachea and bronchial tube, false membrane in throat, that is given in the diphtheria, acetic acid, profuse bronchoria, putrid sore throat, gargle, back pain in back relieved only by lying in abdomen. Extremities, emaciation, edema of feet and leg. Okay. Pale waxen edematous, burning, dry, hot skin or bathed in profuse sweat. Diminished sensibility of the surface of the body, useful after sting bites, etc. Varicose swelling, scurvy, anasarca bruises, sprain. Okay. This is mentioned. Okay. Now the next drug I am going to read is acetic acid aconite napellus. The aconite napellus, mm, common name is monk's hood, family is Ranunculaceae. Okay. Ailment from complaint caused by exposures to dry cold air, dry north or west wind, or exposures to draught of cold air while in a perspiration, bad effects of checked perspiration. Okay. In generally indicated in acute or recent cases occurring in young person, especially girls of a full plethoric habit who lead a sedentary life, person easily affected by atmosphere changes, dark hair and eyes, rigid muscular fiber, great fear and anxiety of mind with great nervous excitability, great fear and anxiety of mind with great nervous excitability, afraid to go out, to go into a crowd where there is any excitement or many people, to cross the street. Great fear, anxiety of mind with great nervous excitability, afraid to go out, to go into a crowd where there is any excitement or many people, to cross the street. The countenance is expressive of fear. The life is rendered miserably by fear. Ensure his disease will prove fatal, predicts the day he will die, fear of death during pregnancy. So the aconite is a main keynote is the fear. Even they feel like the life is rendered miserable by fear, is sure his disease will prove fatal, like he will die, and he predicts the day. Even he predicts at day which day he will die. Fear of death during pregnancy. Even there is a fear that the person will die during the pregnancy. Restless, anxious, does everything in great haste, must change position often, everything startles him. Hahnemann says, what Hahnemann says about aconite napellus: whenever aconite is chosen homeopathically, you must above all observe the moral symptoms and be careful that is closely resemble them. The anguish of mind and body, the restlessness, the disquiet not to be allayed. Okay. This mental anxiety, worry, fear accompanies the most trivial element. Okay. Music is unbearable. Like music they can't tolerate. Music they can't tolerate. Makes her sad. Music makes her sad. Music unbearable makes her sad. Okay. Generalities. Pains are intolerably tolerable. They drive him crazy. He becomes very restless at night. On raising from a recumbent position, the end face becomes deathly pale, or he becomes faint or giddy and falls, and he fears to rise again, often accompanied by vanishing of sight and unconsciousness. Okay. For congestive stage of the inflammation before localization take place. Okay. Respiratory system: cough, croup, dry hoarse, suffocating, loud, rough, croaking, hard, ringing, whistling on expiration, causticum on inhalation, spongia. Okay, causticum on inhalation from dry cold winds or draft of air. Okay. Female reproductive system: amenorrhea in plethoric young girl after fright to prevent suppression of menses. Okay. Central nervous system: convulsion of teething children, heat, jerks and twitches of single muscles. Child gnaws its first it, its fist, frets and scream. Skin hot and dry. High. The most important thing in aconite is fever. Fever. Let's see how the fever is. Fever: skin dry and hot. Skin dry and hot. Okay, skin dry and hot. Face red. Face will be red. Sarita, hi. Hello, Sarita. Okay, fever, skin dry, hot, face red or pale. Pale and red alternatively. Burning thirst for large quantities of cold water. Burning thirst with large quantities of cold water. Okay. Burning thirst for large quantities of cold water. Intense nervous restlessness, tossing about in agony, becomes intolerable towards evening and on going to sleep. Okay. Aconite should Aconite should never be given simply to control the fever. Never alternated with other drug for that purpose. If it be a case requiring aconite, no other drug is needed. Okay, that much confident on aconite. Wow, aconite will cure the case unless indicated by the exciting cause is nearly always injurious in the first stage of typhoid fever. You should never give the aconite in the typhoid fever. Okay, typhoid fever, the best remedy you can give is baptisia. Okay. Aggravation: evening and night pains are insupportable in a warm room when rising from bed, lying on affected side. Hepar sulf and nux vomica. Amelioration in open air: alumina, maccar, pulsatilla, sabadilla. That is important. Actia racemosa, black cohosh, Actia racemosa. Okay, black cohosh, Ranunculacea family. Mind: puerperal mania, thinks she is going crazy, compares syphilinum, tries to injure herself. Okay. Mania following disappearing of neuralgia. That is important. Sensation as if heavy, Sensation as if heavy black cloud settled all over her and enveloped her head so that all is darkness and confusion. Illusion of mouse running from under her chair. That is very important in Actia racemosa. Or other drug also there, lac caninum and athusa. Wait, let me write this. Illusion, illusion of mouse running from under her chair, lac caninum and athusa and one more drug is Actia racemosa. Okay. Vision, eyes and vision. Ciliary neuralgia, aching or sharp, darting, shooting pain in globes. Ciliary neuralgia, aching or sharp, darting, shooting pain in globes, extending to temples, vertex, occiput, orbit, going up upstairs, lying down. Okay. Heart and circulations. Let's see what is mentioned in the Actia resmosa about heart and circulation. Heart troubles from reflex symptoms of uterus or ovaries. It is mostly mentioned. It is given for the female medicine, but when there is a relation of the ovaries and heart, like heart troubles from reflex symptoms of the uterus or ovaries, heart's action ceases suddenly, impending suffocation, palpitation from least motion. That is also mentioned in the digitalis. Okay. Central nervous system about rectier racemosa. What spasm, hysterical or epileptic reflex from uterine disease. Worse during menses, chorea, aggravation left sided. Okay. Musculoskeletal system, excessive muscular soreness after dancing, excessive muscular soreness after dancing, skating or other violent muscular exertion. Okay. Rheumatic pain in muscle of the neck and back, feel stiff, lame, contracted, spine sensitive from using arm in sieving. Spine, it will be sensitive in the person, those who do silai ka kaam, typewriting, piano playing, and also mentioned in the agaricus and ranunculus bulbosus. Wait, again I will repeat the symptoms in Hindi. Okay. जो स्पाइन, ये जो रीढ़ की हड्डी होती है वो सेंसिटिव होती है उन लोगों में, उनमें दर्द होता है नेक और बैक में, जो सिलाई का काम करते हैं, जो टाइप राइटर्स होते हैं और जो पियानो प्ले करते हैं. ठीक है. Actia racemosa we can give. Also, it is mentioned in the agaricus and ranunculus bulbosus. Rheumatism affecting the bellies of the muscles, pain, stitching and cramping. These all the symptoms. Then we can read about the female reproductive system. It is most important in the Actia racemosa. Menses, irregular, exhausting, aluminum cocculus, delayed or suppressed by mental emotion. Okay. Menses, irregular, exhausting, delayed or suppressed by mental emotion, from cold, from fever, with chorea, hysteria or mania, increases the mental symptom during menses. This hysteria is a kind of mania, sudden mood alteration from joyful to the anger or anger to the joyful, and crying, suddenly they are laughing and crying. Okay, these things happens in the female. So it is mentioned during menses, these things exaggerate symptoms will come. Pregnancy, nausea, sleeplessness, false labor like pain, sharp pains across the abdomen, abortion at third month. Abortion at third month, it is mentioned the Sabardilla and Actia racemosa. Abortions at third month. Abortion at third month, Actia racemosa and Sabardilla. Sabina, sorry, Sabardilla nahi, Sabina. During labor, during labor time, shivering is the first stage. Convulsion from nervous excitement, rigid os, pain severe spasmodic, tedious, that is by least noise. After pains worse in the groins. After pains worse in the groin. Okay. When given during last month of the pregnancy, shortens labor if symptom correspond. No, no, Caulophyllum and pulsatilla. Okay. When given during last month of the pregnancy, प्रेगनेंसी के लास्ट मंथ में अगर हम ये ड्रग देते हैं तो शॉर्टेज द लेबर इफ सिम्टम्स करेस्पॉन्ड, ये लेबर पेन को कम कर देता है अगर सिम्टम्स मैच करते हैं तो. ड्यूरिंग मेंस्ट्रुएशन द मोर प्रोफ्यूज द फ्लो द ग्रेटर द सफरिंग. ओके. Actia spicata, that is mostly given for the especially suited to men Actia racemosa to women. See here it is clearly written Actia spicata, it is specially suited to men. Actia racemosa to the women. It is mentioned in the LN. Violent, violent tearing pain runs from delayed tooth to temple. So the symptom is Actia spicata. It is mentioned on the constitution for whom we can give the Actia spicata is especially suited to men. Actia racemosa to the woman. Violent tearing pain run from delayed tooth to temples. Violent tearing pain run from delayed tooth to temple. Rheumatism pain notably affecting small joints. This is mostly given in the small Actia spicata, small joints like wrist, fingers or ankle and toes. Swelling of joints from slight fatigue. Swelling of joints from slight fatigue मतलब जॉइंट्स में सूजन आ जाती है अगर थोड़ा सा भी थकान होता है तो ठीक है. लेमनेस ऑफ राइट आर्म. Genital urinary system throbbing in the region of kidney, urinary calculi. Okay, asculus. Now we'll read about asculus. The most important symptom we can think of asculus in is hemorrhoid. Okay, let's see. Asculus. Common name is horse chestnut. Sapendi, Sapendaceae. Oh, that is family. Okay. Constitutions for the person with hemorrhoidal tendencies and who suffer with gastric, bilious and catarrhal troubles. Okay, this is the introduction, that is constitution. Despondent, gloomy, very irritable, loses temper easily and gains control slowly. Miserly, cross, that is chamomilla also. Generalities, painful in various parts as from an undue amount of blood. Heart, lungs, stomach, brains, pelvis, skin, venous congestion, especially portal and hemorrhoidal. Mucous membrane of mouth, throat, rectum or swollen, burn, feel dry and raw. Okay. Follicular pharyngitis, violent burning, follicular pharyngitis, throat. Follicular pharyngitis, violent burning, raw sensation in throat, dryness and roughness of throat. Okay. Frequent inclination to swallow with burning, pricking, stinging and dry constricted fauces. Okay. Apis and belladonna. Respiratory system. Coryza, thin watery, burning, rawness and sensitive to inhaled cold air. Okay. Coryza, the Asculus, coryza, thin watery, burning, rawness, sensitive to inhaled cold air. Okay. Rectum, that is most important, stomach and abdomen. Rectum, dryness and heat of, feel as if full of small sticks. इन हेमोरॉइडल पेशेंट जो हेमोरॉइड जिसको पाइल्स होता है उनमें क्या होता है सिम्टम्स, एज इफ फुल ऑफ स्मॉल स्टिक्स, नाइफ लाइक पेन शूटिंग फ्रॉम द रेक्टम, जैसे चाकू घुसने का पेन रहता है ना वैसा रहेगा. और इग्नेशिया, सल्फर, हेमोरॉइड्स, blind, hemorrhoids blind in the sense there is no bleeding. Hemorrhoids blind, painful burning, purplish, rarely bleeding. Okay. Rectum sore with fullness, burning and itching, sulfur. Rectum sore with fullness, burning and itching, it is mentioned in the sulfur. Constipation, hard, dry stool, difficult to pass with the dryness and heat of rectum, severe lumbosacral backache. constipation, hard dry stool difficult to pass with dryness and heat of the rectum, severe lumbosacral backache, stool followed by fullness of rectum and intense pain in anus for hours, aloes, ignatia, muriatic acid and sulfur, prolapsus uteri, female, prolapsus uteri and acrid dark leukorrhea with lumbosacral backache and great fatigue from walking, severe dull backache in lumbosacral articulation. That is most important in the asculus is backache with hemorrhoids. Likewise, severe dull backache in lumbosacral articulation. Okay, more or less constant affecting sacrum and hips. Back gives out during pregnancy, prolapsus leukorrhea when walking or stopping, must sit or lie down. Sensation of heaviness and lameness in back, paralytic feeling in the arms, legs and spine. Motion, aggravation, motion, backache and soreness by walking and stooping, inhaling cold air. Athusa, fool's palsy. I'll read from the SCLN only. This is very interesting and it will be helpful for my exam. Hello, my journey. Hello, hello, hello. My journey P5. Hello. Athusa. Synapium. Fools, the common name is fool's palsy. आप किस चीज़ की तैयारी कर रहे हैं? एक्चुअली मैं AIPGT एग्ज़ाम की तैयारी कर रहा हूँ. पीजी इन होम्योपैथी, MD स्कॉलर इन होम्योपैथी. मैंने यूजी कर लिया है, यूजी पास आउट हूँ और पीजी करने नेक्स्ट ईयर पीजी का एग्ज़ाम है तो वो मैं देना चाहता हूँ और मुझे पीजी करना है. ओके, आपको समझ में आया या फिर मैं आपको और किसी इजी शब्द में समझाऊँ? देखिए, MBBS होते हैं, BDS होते हैं जो डेंटिस्ट होते हैं, फिर उसके बाद BAMS, BHMS, BUMS, लॉट ऑफ कैटेगरी इन द डॉक्टर लिस्ट. ठीक है, डॉक्टर लिस्ट में बहुत सारे होते हैं. तो मैंने क्या किया था, BHMS मीन्स होम्योपैथी मैंने किया. फिर उसके बाद मैं सोच रहा हूँ कि इस बार मैं पीजी के लिए भी ट्राई कर सकता हूँ, वरना मैं अपनी क्लिनिक डालूँगा. अगर मेरा पीजी में नहीं हुआ, हो जाएगा, मैं जिस हिसाब से पढ़ रहा हूँ मेरा पीजी में हो जाएगा. और कहीं भी किसी भी कॉलेज में, गवर्नमेंट मैं ट्राई कर रहा हूँ, गवर्नमेंट कॉलेज में अगर मिल जाता है तो वेल एंड गुड, वरना देखते हैं क्या होता है. ठीक है, रिगार्डिंग NEET, regarding AIPGT, regarding doctor, regarding any disease, if you have a query you can uh, text me or you can follow me. मैं डेली लाइव आता हूँ 9 to 11, कभी कभी 8 to 11 भी आता हूँ, डिपेंड्स ऑन टाइम. और ओके, मैं हॉस्पिटल भी जाता हूँ और तो उस वजह से दिन में बहुत कम टाइम मिलता है, लेकिन इवनिंग में मोस्टली मैं पढ़ाई करता हूँ. इवनिंग में इन द सेंस जब भी मुझे टाइम मिल जाता है तो 11 o'clock तक मैं पढ़ाई करता हूँ. ठीक है. एथ्यूसा साइनेपियम, स्पेशली फॉर द चिल्ड्रेन ड्यूरिंग डेंटिशन. एथ्यूसा बच्चों के लिए बहुत अच्छी मेडिसिन होती है जब उनको दांत निकलते हैं. इन हॉट समर वेदर, चिल्ड्रेन हु कैन नॉट बियर मिल्क, चिल्ड्रेन हु कांट बियर मिल्क, जो बच्चे जिनका डेंटिशन दांत के टाइम पे जिनको बहुत ज़्यादा प्रॉब्लम्स होता है और जो दूध नहीं पी पाते हैं. ठीक है. माइंड epileptic spasm with clenched thumbs, red face, eyes and vision turns downward, pupils fixed and dilated, foam at mouth, jaws locked, pulse small, heart quick. Okay. Great weakness, Children cannot stand, unable to hold up the head, abrotanum. Prostration with sleepiness, complete absence of thirst. This is very important symptom. Complete absence of thirst. It is mentioned in the pulse. Uh, Apis, Ethusa. Okay. Intolerance of milk, cannot bear milk in any form. It is vomited in large curds as soon as taken. Then weakness causes drowsiness. Compare Macar. Weakness and prostration with sleepiness after vomiting, after stool, after spasm. Okay. आप किस चीज़ की तैयारी कर रहे हैं, मैंने आपको बताया, राइट, माई जर्नी। आई थिंक मैंने आपको बताया कि जो पीजी होते हैं ना, पीजी लाइक ओके, कैसे बताऊँ आपको, AIPGT एग्ज़ाम एक होता है जो डॉक्टर के लिए होता है, उसकी मैं तैयारी कर रहा हूँ। आई एम अ डॉक्टर, आई एम अ यूजी, मैंने एक डॉक्टर की एक डिग्री हासिल कर ली है, बट मुझे पीजी करना है जिसे एमडी बोलते हैं, वो उसकी तैयारी मैं कर रहा हूँ। क्या आप न्यू यूट्यूबर हैं? हाँ, न्यू यूट्यूबर हूँ, यस। सब्सक्राइब कर लीजिए, आपको बहुत कुछ देखने को मिलेगा। लाइक करिए वीडियोस को, ठीक है। आप 11, आप जो भी आपको पूछना है, टिल 11 में लाइव रहूँगा। 5-10 मिनट्स आपके क्वेश्चंस का जवाब दूंगा। अभी तो मैं पढ़ लेता हूँ थोड़ी देर। आपको कुछ पूछना है रिलेटेड टू डिजीज़, आपको कुछ अपनी बीमारी के बारे में जानना है, घर में कोई बीमार है या फिर हेल्थ इशू है, कुछ भी है, तो आप मेरे से पूछ सकते हैं। Indigestion of teething children, violent sudden vomiting of frothy milk, white substance or yellow fluid, followed by curdled milk and cheesy matter. Regurgitation of food an hour or so after eating, copious greenish vomiting. Central nervous system, idiocy in children, incapacity to think, confused, aggravation after eating or drinking, after vomiting, after stool, after spasm. Okay, agaricus. Now I will read the agaricus. Toad stool. The common name is TOAD, toad, STOO, stool, and it is a fungi. Sorry, it is a fungi. Person with light hair, skin and muscle lacks. Delirium with constant raving, tries to get out of the bed in typhoid or typhus. Okay. Old people with weak indolent circulation. Old people with weak, ओके, मैं भी न्यू यूट्यूबर हूँ, ओके, क्या आप न्यू यूट्यूबर, ओके, ओके। डिलीरियम विद कॉन्स्टेंट रेविंग, ट्राइज टू गेट आउट ऑफ द बेड इन टाइफॉइड और टाइफस. ओल्ड पीपल विद वीक इंडोलेंट सर्कुलेशन. ड्रंकार्ड्स स्पेशली फॉर दियर headaches, bad effects after a debauch, lobelia, nux vomica, ranunculus bulbosus. Uncertainty in walking, stumbles over everything in the way, feels pain as if beaten when standing, nervous prostration after sexual debauches, extremely sensitive to cold air, calcarea, calicarp and sorinum. Okay. Here diagonally, upper left and lower right side, antium tart, stramonium, upper right, lower left, umbra gracia, bromium, medorinum, phos, sulfuric acid. Headache. In the head, agaricus. Headache of those who readily become delirious, in fever or with pain, belladonna. Of persons subject to chorea, twitching or grimace from spinal affection. Central nervous system, involuntary movement while awake, cease during sleep, chorea from simple motion and jerk of single muscle to dancing of whole body, trembling of whole body. Okay, now I got trembling of whole body. It is fungi, no? So means okay, trembling of whole body. Twitching of muscle of face, mygale. Twitching of muscle of face, mygale. Spinal irritation due to sexual excess, caliphos. Spinal irritation due to sexual excess. Epilepsy from suppressed eruption, sorinum and sulfur. Uncertainly in walking, stumbling gait. Female reproductive system. Prolapsus, post-climactic, bearing down pain, almost intolerable. Compare lilium. Okay. Prolapse, post-climactic. The post-climactic is like menopause. After menopause, after 30 years of the life in female, bearing down sensation. Spine sensitive to touch, back. Spine sensitive to touch, theridion. Worse morning. Spine sensitive to touch, worse morning. Pain, sore, aching in lumbar and sacral region during exertion. In the daytime while sitting, zincum. Every motion, every turn of the body causes pain in spine. Every motion, every turn of body causes pain in spine. Okay, skin, that is very important symptom in agaricus. Skin, chilblains, chilblains that itch and burn intolerably. Chilblains that itch and burns intolerably. Frostbite, पानी और हाथ या फिर पानी में हाथ या पैर बहुत ज़्यादा टाइम तक अगर रहता है तो चिलब्लेंस हो जाता है या फ्रोस्ट बाइट हो जाता है. एंड ऑल consequences of exposures exposures to cold, especially chilblains that itch and burn intolerably, frostbite, and all consequences of exposures to cold, especially in face. Sensation as if ice touch. This is very important. Many places I have read this. Many books I have read this. Said hi. Prince. Prince bhai. Hi. Prince. Prince hi. Sensation as if ice touched or ice cold needles were piercing the skin as from hot needle. Hot needle. लाइक करो भाई, लाइक करो, सब्सक्राइब करो चैनल को प्लीज़. Hot needle. Burning, itching, redness of various parts. Burning, itching, redness of various parts ear, nose, etc. Okay, this is agaricus. Now I will read the agnus cactus. Agnus cactus, absent-minded for lymphatic constitution. Castor tree, Agnus, Agnus cactus. कर लिया सर सब्सक्राइब. थैंक यू सो मच प्रिंस. थैंक यू सो मच भाई. थैंक्स फॉर सपोर्टिंग. थैंक यू सो मच. थैंक यू सो मच. आपको कोई कंप्लेन है, कोई भी तकलीफ़ है, घर में किसी को तकलीफ़ है, आप बताइए. आई एम अ डॉक्टर. बेस्ट एडवाइस दूंगा, बेस्ट दवा का बताऊंगा आपको. ठीक है. घर में किसी को भी कोई भी तकलीफ़ है, आप बता सकते हैं. आपको कोई तकलीफ़ है तो आपको मैं दवा बता सकता हूँ या फिर बेस्ट एडवाइस दे सकता हूँ. कभी कभी दवा की ज़रूरत नहीं होती, तो कभी कभी और चीज़ें कर सकते हैं जिससे आपका कंप्लेन, जिससे आपकी तकलीफ़ें कम हो जाए. ठीक है. तो इन एग्नेस इट इज़ मेंशन प्री मेच्योर ओल्ड एज. जो इंसान बहुत जल्दी ओल्ड दिखने लगता है उसके लिए दवा है. मेलंकोली, अपैथी, मेंटल डिस्टर्बेंस, mental distraction, self contempt arising in young person from abuse of sexual power. सेक्सुअल पावर अब्यूज़ करने से बहुत जल्दी प्रीमेच्योर ओल्ड एज, उनको ओल्ड एज बहुत जल्दी हो जाता है. दैट इज मेंशन इन एग्नस. फ्रॉम सेमाइनल वेसल्स, seminal loss. Old sinners with impotency and gleet. Unmarried person suffering from nervous debility. Okay. Bad effects from suppressed gonorrhea. Medorinum. Complaints of imaginary odor before the nose as of herring or musk. Sorry. Complaints of imaginary odor before the nose as of herring or musk. Okay. Prevent excoriation from walking. Complete impotency. In Agnes, complete impotence. Relaxation, flaccidity, coldness of genitalia, no sexual power or desire. Caladium and selenium. Caladium and selenium. No sexual power, in complete impotency will be there. Impotency after frequent attack of gonorrhea. Impotence after frequent attack of gonorrhea. Okay. Gleat with absence of sexual desire or erection. Gleat, sexual desire or erections. Okay. Gleat is what? Gleat, gleat, gleat. I think yellowish discharge will be there. One second. GLAAT, gleat meaning. Gleat, a thin watery or mucus discharge from the wound or bodily orifice commonly associated with the stage of chronic gonorrhea, but can also mean the inflammation of itself discharge. Okay. Watery mucus discharge from the bodily orifice. Okay, okay, great. Gleat with absence of sexual desire or erection. Leukorrhea in female reproductive system. Leukorrhea. Agnes mostly given to the male. It is male remedy. Complete impotency, complete no sexual power or desire. that is mentioned in the caladium and selenium. Leucorrhea transparent but staining linen yellow passes imperceptibly from the very relaxed parts. Leucorrhea transparent but staining linen yellow passes imperceptibly from the very relaxed part. Okay. Deficient secretion or suppression of milk in nursing women. Asafoetida lac caninum black defloratum, often with great sadness, say she will die. Okay. Deficient, deficient, transparent, or suppression of milk in nursing women, SF, lac caninum, lac defloratum, often with great sadness, says she will die. Okay. Caladium and selenium follows well after agnes and weakness of sexual organs or impotency. Allium cepa, onion, Allium cepa onion कर लिया सर जी. Okay, thank you. Onion, Liliaceae. Allium cepa, it is made from the raw onion. Acute catarrhal inflammation. Allium cepa, I can tell you the story like कैसा हम ओनियन प्याज को काटने के टाइम पे हमें जो जो चीज़ें होती हैं, अगर वो चीज़ें हुई हैं आपको, जैसा कि आपको कोल्ड हुआ है, क्या क्या चीज़ें, acute catarrhal inflammation of the mucous membrane with increased secretion, sparing coryza from damp north easterly winds, discharge burns जो आप नाक से जो डिस्चार्ज गिरेंगे वो बहुत ज़्यादा बर्न्स, and corrode nose and upper lips. Hay fever in August every year. Violent sneezing on rising from bed from handling peaches. Head seizes during menses. Headache seizes during menses, returns when flow disappear. This is very important symptoms. Headache seizes during menses, reappears or returns when flow disappear. Okay, zinc laxis and um, zincum. In vision, eyes and vision. Eyes burning, biting, smarting as from smoke. Must rub them. Watery and suffocated capillaries. Injected and excessive lacrimation. Respiratory system. Oh, sorry. Catarrhal dull headache with coryza. In the evening, catarrhal dull headache with coryza in the evening in open air or returning to the warm room. Compare euphrasia pulsatilla. Compare euphrasia and pulsatilla. Catarrhal dull headache with coryza in the evening, open air on returning to a warm room. Compare euphrasia pulsatilla. Coryza profuse, watery and acrid nasal discharge with profuse bland lacrimation. Profuse, full of acrid lacrimation, bland and fluent coryza is euphrasia. Acrid, watery discharge dropping from the tip of the nose. Ars and ars iode. Acrid, watery discharge and watery discharge dropping from tip of nose, that is ars and ars iode. Nasal polyps. Catarrhal laryngitis. Cough compels patients to grasp the larynx. Seems as if cough would tear it. Catarrhal laryngitis. Cough would tear it. पेशेंट ऐसा फील करते हैं एलियम सेपा वाले पेशेंट में, मतलब उनको कफ इतना ज़्यादा रहता है पर ऐसा लगता है कि दोनों जो लैरिंग्स है ना वो फट जाएंगे, दोनों अलग हो जाएंगे. Stomach and abdomen, that is not important. aloes, that is the last remedy which I am going to read is aloes. Aloes, sco- socotrine aloes, okay. Ad, Liliaceae family, adapted to indolent weary person, averse to either mental or physical labor, mental labor fatigues, okay. Old people, especially women, or relaxed phlegmatic habit, extreme prostration with perspiration, mind dissatisfied and angry about himself or his complaints, especially when constipated. So I'm reading the aloes drug, dissatisfied and angry about himself or his complaints, especially when constipated. जब पर्सन, जिस पेशेंट को अगर कॉन्स्टिपेशन रहेगा ना, बहुत ज़्यादा एंग्री रहेगा और डिससेटिस्फाइड, अपने से सेटिस्फाई नहीं रहेगा, ठीक है. Generalities, disease of mucous membrane like causes the production of mucus in jelly like lumps from throat or rectum, okay. Affects mucous membrane of rectum, मतलब एलोस पेशेंट जो जिसको हेमोरॉइड पाइल्स होता है ना, वो जेली लाइक म्यूकस जैसा उनके रेक्टम से निकलता है, ठीक है, ऐसा फील होता है. ईच अपीयर्स एवरी ईच ईयर एज विंटर्स अप्रोचेस, दैट इज सोराइनम. एक्सट्रीम प्रोस्ट्रेशन विद पर्सपिरेशन. सर दवा बताइए, किस चीज़ का बताइए, बताऊँ दवा बताइए आप. प्रिंस बताइए किस चीज़ का दवा बताऊँ, क्या प्रॉब्लम है, क्या तकलीफ़ है आपको. हेडेक अक्रॉस द एब्डोमेन, forehead, extreme prostration with perspiration, headache across the forehead by every footstep, Bell's brownia with heaviness of eyes and nausea. ओके ठीक है. प्रिंस बताइए क्या दवा आपको जाननी है. अब वैसे भी 11 बज गया है, कुछ देर के लिए इंटरेक्शन कर लेता हूँ मैं. सेड हाय, हेलो. हाँ प्रिंस बताइए क्या तकलीफ़ है आपको. प्रिंस क्या आप मुझे सुन रहे हैं. किस चीज़ की दवा जाननी है आपको, क्या तकलीफ़ है. और भी किसी को कोई तकलीफ़ है आप बता सकते हैं. आई एम होम्योपैथिक डॉक्टर. तो हाय. दाद आपको है, रिंगवर्म, और कुछ दैद भी है. आपने इसके पहले कुछ पूछा था क्या कि क्या हुआ है आपको. अच्छा आपको दाद है. देखिए दाद कितने मतलब एक दवा है बैसिलिनम, ठीक है. बैसिलिनम दवा आप ले सकते हैं वीकली एक बार, ठीक है. लेकिन इंटेंसिटी पता होनी चाहिए कि आपको कहाँ कहाँ पे हुआ है. आपको दाद कहाँ पे हुआ है एग्जैक्टली exactly? या फिर आप बता सकते हैं. मैं समझ सकता हूँ कि दाँत बहुत जल्दी क्योर नहीं होता है, बहुत जल्दी ठीक नहीं होता है. दाँत जिसको हो जाता है वो बहुत टाइम तक रहता है, लेकिन इम्पॉसिबल टू क्योर नहीं है. ये ठीक हो जाता है, ठीक हो जाता है अच्छे से. अगर आप अच्छे से अपना कंसल्टेशन करेंगे, अच्छे डॉक्टर से मिलेंगे, तो आपको आपका दाँत सही हो जाएगा, ठीक है. लेकिन आप बता दीजिए कि आपको दाँत कहाँ पे हुआ है, तो मैं उस हिसाब से आपको दवा बता देता हूँ. और किसी को कोई तकलीफ़ है आप वो भी बता सकते हैं। जांग के नीचे, अच्छा अच्छा ठीक है। आप बैसिलिनम आप दवा एक लीजिए, बैसिलिनम 1 एम। बैसिलिनम एक दवा है, 1 एम की दवा लीजिए, आपको 1 महीने में आपको रिज़ल्ट दिख जाएगा। एक दो ड्रॉप में ही, एक दो डोज में ही आपको दिख जाएगा रिज़ल्ट। ठीक है, बैसिलिनम। बहुत ज़्यादा ईचिंग हो रही है, बहुत ज़्यादा खुजली होती है। ओके। अगर आपको, अगर आप कहाँ से हैं, आप अगर आपके इलाके में, आपके लोकेलिटी में कहीं पे भी होम्योपैथिक डॉक्टर हैं तो आप उनसे एक बार कंसल्ट कर लीजिए, वो ज़्यादा बेटर रहेगा। फिर भी मैं आपको दवा बता देता हूँ, लेकिन आप अगर होम्योपैथिक डॉक्टर के पास अगर आप जाएंगे और आप बताएंगे कि मुझे होम्योपैथी दवा ही चाहिए और मुझे ये दवा, जो दवा मैंने बताया है वो बैसिलिनम आप कर लीजिए। हाँ ठीक है, फिर आपका सही हो जाएगा। बस यही है कि आप गर्म जो ज़्यादा देर तक आप नहाने के बाद वो पानी को बहुत अच्छे से साफ़ कर लीजिए। पानी पूरे बॉडी में, पानी ज़्यादा देर तक नहीं रहना चाहिए। ठीक है। और गीला कपड़ा नहीं पहनना है आपको, एकदम सूखा कपड़ा पहनना है। आपके आपके कपड़े और आपका साबुन, आपका सोप, डिटर्जेंट, जितना भी चीज़ें हैं वो सबसे अलग रहना चाहिए। ठीक है। जब भी आप नहाए तुरंत आप अपने बॉडी को अच्छे से पोंछ के तभी कपड़ा पहने आप। उस उस पार्ट को जहाँ पे हुआ है उस पार्ट को ज़्यादा देर तक गीला या फिर ह्यूमिड नहीं रखना है। ठीक है। और कोई तकलीफ़ है? और किसी को कोई तकलीफ़ है आप बताइए, क्या प्रॉब्लम है, मैं दवा बताता हूँ आपको। सर मैं अभी तो हॉस्टल में पढ़ाई करता हूँ। अच्छा अच्छा, आप हॉस्टल में पढ़ाई करते हैं। हाँ तो आपके कॉलेज में कैंप आता होगा ना? तो कैंप अगर होता होगा तो वहाँ पे आप बता दीजिए किसी भी डॉक्टर को, वो अच्छे से ट्रीट कर देंगे। स्टेरॉइड कभी भी मत लीजिए, बहुत सारे डॉक्टर्स आपको स्टेरॉइड देंगे, जो वो चीज़ें कभी भी मत लीजिए। स्टेरॉइड का साइड इफ़ेक्ट बहुत ज़्यादा है, तो स्टेरॉइड मत लेना। ठीक है। बहुत सारी तकलीफ़ें बढ़ सकती हैं, तो स्टेरॉइड मत लीजिएगा। हॉस्टल में ये चीज़ें देखो, मैं मानता हूँ कि दाद बताना और आपको शर्म आती होगी या फिर कैसे मैं बताऊँ, ऐसा ऐसा कुछ मत सोचिए। डॉक्टर आप चाहिए, डॉक्टर को आप अपनी तकलीफ़ बताए, वो किसी और से कभी भी, डॉक्टर एक प्रोफेशन सिक्रेसी होता है, वो कभी किसी और से शेयर नहीं करेंगे कि इस चीज़, इस बंदे को, इस पेशेंट को ऐसा कुछ हुआ है। ठीक है। वो आपकी प्रॉब्लम्स को अच्छे से सुनेंगे और उसका सल्यूशंस भी बताएंगे। ठीक है। और किसी को कोई तकलीफ़ है चैनल को सब्सक्राइब कर लीजिए। 11:15 तक मैं लाइव रहूँगा, उसके बाद किसी को कोई और प्रॉब्लम है? या थैंक यू, वेलकम वेलकम। थैंक यू सो मच। और किसी को कोई तकलीफ़ है आप बताइए, कमेंट करिए। और यार आप मुझसे कंसल्ट करना चाहते हो तो आप मुझसे कंसल्ट भी कर सकते हैं। मेरा नंबर आप लिख सकते हैं, 8655495018। और इस पर आप व्हाट्सअप कर सकते हैं, कॉल कर सकते हैं, और आपको मैं प्रॉपर केस टेकिंग, प्रॉपर केस टेकिंग के साथ आपको प्रिस्क्रिप्शन, दवा, ये सब चीज़ें मैं बता सकता हूँ। और किसी को कोई तकलीफ़ है, आप बता सकते हैं क्या तकलीफ़ है, क्या प्रॉब्लम है। किसी को कोई बीमारी है, किसी को एलर्जी की प्रॉब्लम है, पेट का प्रॉब्लम है, हेडेक का प्रॉब्लम है, एनी डिजीज़ if you are suffering from, you can tell, you can share to me, you can comment here, or you can specially comment on my channel, और आप मुझसे मेरा नंबर ले सकते हैं। हाँ, 5 मिनट और, 11:15 को लाइव ख़त्म कर दूंगा मैं। और किसी को कोई तकलीफ़ है, आप बता सकते हैं। कोई भी प्रॉब्लम, कोई भी डिज़ीज़, कोई भी बीमारी, एनी फीमेल रिलेटेड प्रॉब्लम। सर गन क्यों? आपको पाइल्स है क्या? गन क्यों दर्द करता है? किसको दर्द हो रहा है? घाट में किसको दर्द हो रहा है? हाँ कहिए प्रिंस। मॉम को? अच्छा अच्छा, आपकी मम्मी को। उनको ना ऑस्टियोआर्थराइटिस हो सकता है आता हूँ मैं। उनके गांठ में अगर दर्द है तो उनको ऑस्टियोआर्थराइटिस होता है, जो एज होने के बाद जब हम ज़्यादा चलते हैं ना, तो ये तो देखो, ये हो गई हड्डी अपनी, ठीक है, ये, ठीक है, ये घुटना हो गया, घुटने का जोड़ हो गया, तो ये ज़्यादा चलने से ना, तो ये दोनों पे ये दोनों एक हड्डियाँ एक दूसरे को रगड़ने लगती हैं, ठीक है, इसकी वजह से दर्द होता है, ठीक है। और एज अगर हो जाती है तो उसके हिसाब से भी हार्मोनल डिसबैलेंस की वजह से भी उनको दर्द होता है, उनके बॉडी में कैल्शियम बहुत कम हो जाता है, तो उस वजह से उन यहाँ पे दर्द होता है, ठीक है। तो बहुत बहुत ज़्यादा से ज़्यादा आप क्या कर सकते हैं कि ये चीज़ें उनको अगर काम ज़्यादा कर रहे हैं आपकी मम्मी, तो उनको काम बहुत कम, आराम की ज़रूरत है बहुत ज़्यादा, ठीक है। उनको चलना बहुत ज़्यादा अलाउ मत करो, ठीक है। अगर उनका वेट बहुत ज़्यादा है, आपकी मम्मी का अगर वेट बहुत ज़्यादा है तो उनका वेट कम करने बोलिए, ठीक है। और दवा मैं बताता हूँ, रस्टॉक्स और ब्रायोनिया, दो दवा आप अल्टरनेटिवली उनको दे सकते हैं, एक हफ्ते में आपको बहुत अच्छा रिजल्ट मिलेगा रस्टॉक्स और ब्रायोनिया अगर आप देंगे तो, ठीक है प्रिंस। मम्मी का गांठ का दर्द वो सही हो जाएगा, ठीक है, ऑलमोस्ट बहुत 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 कम हो जाएगा। लेकिन उनका अगर वेट बहुत ज़्यादा है, उनका वेट भारी है, तो उनको वेट कम करने की ज़रूरत पड़ेगी, क्योंकि जो जॉइंट पेन होते हैं ना, वो वेट बेयरिंग है। ये जो अपना जॉइंट गांठ या फिर नी जॉइंट है ना, उसमें उस वेट बहुत ज़्यादा अगर रहता है ना, तो उनको दर्द बहुत ज़्यादा होता है, ठीक है। आई होप आप समझ गए हैं, ठीक है। मैं मिलता हूँ कल 9 to 11, 11:30, और बिटवीन 8 to 11 मैं लाइव आता हूँ। थैंक्स फॉर वॉचिंग, थैंक यू सो मच।